Hi, I'm Kelly Perna, and I am here to share my positive experience with Melissa Monty and the Stoughton Health Occupational Therapy Group. So a couple of years ago, I had a situation where my thumb hurt. It might not sound like a big deal, but it's kind of a big deal. My right hand, you don't realize until it bothers you. Kind of stiff, kind of sore. I was trying to ignore it, did all the things that you know to do at home, heat, ice, massage, whatever. Wasn't getting better. But I was trying to put it off until the day that I realized I needed to open a water bottle and I couldn't get it open. Handed it to my son, "Can you open this for me?" "Mom, seriously, you can't open a water bottle?" And I'm like, oh boy, you're right. It's probably time to address it. So I didn't want to go through the rigmarole. I was dragging my feet. I'm like, I suppose I have to call my primary, go through, the nurse, the triage, how they do. Okay, make an appointment, tell her what I just told you all, and then for her to simply refer me, make the appointment, pay the copay. But then my colleague said, "Oh, you can self-refer at Stoughton Health." And I said, "Didn't know that." So I called the reception at rehab. Woman was lovely, told her my situation. She made the appointment for me. I was placed in the very capable hands of Melissa. She did this fantastic assessment. We had a plan. We had, I think, 6 appointments in a row. At the end of it, I was healed. And it was fun and actually kind of painless. Even the exercises were doable. And it's been, I think, like I said, maybe 2 years now, and I'm as good as new.
Nice. That's awesome. Kelly, I love to hear stories like that. That's one of my favorite parts about being a therapist, and I think I can speak for a lot of therapists when we say literally our favorite part is when we discharge somebody, because we know we've done our job and we've made them feel better, and you can go and open up that water bottle now, and it does give us great satisfaction. And like you said, you self-referred, and a lot of people don't know that you can do that, and it's one of the great services that we have here at Stoughton Health. If you're having an issue, we cover like hundreds of insurance, we accept hundreds of insurance policies. So, give our front desk staff a call and they can get you set up with an appointment, and you don't have to go to your doctor first. That first visit is called an evaluation. So what we do is we take range of motion measurements, we take strength measurements, and then we go and we have lots of special tests that we can do depending on what joint we're working on. And those special tests just help us as therapists really tease out what is going on, and from there we can make a plan of care. And we do that with the help of our clients. We look to them and be like, is it feasible for you to come in twice a week? If not, we know there's lots of people out there that work and have young kids. So then we make do with what works. So whether it's you come in twice a week, once a week, every other week, we really set that plan of care according to what works well for you.
What are some of the other, so I just, had my thumb situation. Yeah. What are some of the other, who else do you see? What other treatments do you give?
That's a great question. So for me specifically, I'm a certified hand therapist, and our other occupational therapists, we all see upper extremity. So whether it be shoulder, elbow, wrist, hand, any of those type of injuries. We have lots of physical therapists on staff, and they see anything from neck, back, hip, ankle, knee pain. So really we treat the whole gamut. Even vestibular, we have vestibular treatment here at Stoughton Health. So if you have any like dizziness, we have 3 certified lymphedema therapists that work with swelling of upper extremity, lower extremity as well.
Excellent. Well, I know where to go if I need more care.
Yeah, we're happy to help.
Thanks.